Well, we are back, you guys, with the medical equipment world and healthcare. Get the scoop. And as always, I'm going to read my little disclaimer here. The podcast where you break down durable medical equipment, patient care, and real world solutions for caregivers, families, and healthcare professionals. I am Tara, your host, the certified medical equipment specialist with CFS Medical Supplies and Equipment, CFS Solutions. And I'm always going to read this disclaimer. The information shared in this podcast is for educational and informational purposes only and is not intended as medical advice. Always consult with your doctor, your physician, or your healthcare professional regarding any medical decision or concerns. Neither the host nor guest assume liability for actions taken based on content discussed in this episode. And you guys always know I say in any other episode. And today, you guys, we are so excited today to have Miss Katalin. And Miss Katalin, I don't know, now I'll mess up some people's names. I'm known for this.
Okay.
So I'm gonna let you say your last name so I do not mess up your name. But I just want to thank you for being here today with us because we love to share information and resources, just letting families know how to navigate the world of healthcare as we know it. So I'm gonna let you go ahead. I'm gonna read your bio, but I want you to pronounce your last name for me, please.
It's Gens.
Yes, I love it. I love it. Beautiful, beautiful. Okay, so Katalin is the founder of O&K Consulting. It is a certified insurance consultant licensed by the state of Connecticut, New York, and Virginia. She has been working in the healthcare all of her life. Katalin started her career as a trauma nurse in Hungary. In the U.S., she provided direct patient care in nursing home settings as well as private nursing. In the late 1990s, she has focused her career on financial aspects of medical care. She has acquired extensive knowledge of the commercial and Medicare insurance procedures, rules, and regulations. Presently runs her own company, Med Bill Assist, helping individuals and families whom are struggling with medical bills. She also assists people better understanding their insurance policies and Medicare. And let me tell you, Katalin, that is so critical, especially, I mean, it's always been critical, and especially now because we see a lot of times where I know I deal with it daily where families don't know exactly even what insurance they have, what's covered. If it's sometimes they don't even know if they have an Advantage plan or traditional Medicare and all those things. So I am so excited to have you here today. Again, thank you for being here on the medical equipment world, in healthcare, get the scoop. So I want you to kind of share us and tell us a bit about how your background, how you got started, and as I read, but just kind of give us a little bit more information here.
Okay. So, um, I was working in hospital settings and I learned a whole lot.
Mm-hmm.
And we used to have patients coming in asking for help.
Okay.
And the whole help other people and being personalized help
Mm-hmm.
came to the idea of advocating for patients.
Mm-hmm.
So I quit my job
Oh, okay.
and I applied for a license in Connecticut. And quickly I got a response saying, "Oh, you're not getting a license. You need to pass a test."
Hmm.
So I was told that they hold on to my money for 30 days and I
Uh-huh.
had 30 days to pass the test. The book was about this thick.
Wow.
So in 2 weeks, I went through the whole book, went to take a test,
Mhm.
passed the test, got my license.
Oh my goodness. Wow. Just wow, that's interesting. Wow.
See, the thing is, I had the necessary background, so I understand,
Uh-huh.
how things work and how things that time worked
Mm-hmm.
because healthcare and the whole financing is constantly evolving.
It is.
What was correct 2 years ago is no longer applicable.
You know what? Try overnight. Like,
Yeah, some of them.
yeah, I tell people like you go to sleep tonight, and it's one thing, and you wake up tomorrow and it's another thing. You just never know. So you're always having to learn and evolve, and there's changes constantly and everything. So wow, yeah. I'm sorry. Oh, go ahead.
So that I started to work and I started to get clients
Hmm.
and I did a lot of networking and I came across of that organization of the Alliance of Claim Assistant Professionals.
Hmm.
So as soon as I seen it, I wanted to be a member
Hmm.
because that is an organization for my profession.
Right.
So I became a member and I was a member for a couple of years. Then I became a secretary.
Hmm. Okay.
And as years went by, our president left, and then our next president left. So I ended up becoming a president of the organization. It's a volunteer position, so it's not like, it just managing the organization, interviewing new members,
Hmm.
um, directly talking to the members. It's a small organization, but the members are very strong on advocacy. And it's really a great group because we not only help the general public, we also help each other and ask questions. So it's a two-tier organization. It's supporting membership and
Hmm.
it's supporting the general public.
Yes, I as a no, and it's a great organization, and that's why I reached out to you because I got to get Katalin on here because I was a member some years ago when I had was doing billings completely that's straight to providers and helping families, and so it was a great organization. I love the community of being able to ask questions and feed off of one another to get that information to help families. And so, yeah, but my time was just like, oh my gosh, can I kind of didn't go into a different direction, but somewhat just kind of continue to do what I do, which is medical equipment. And of course, still helping families and being a patient advocate for families as well. But I didn't have the time any longer to just do that, just, you know, continuously. And
Right.
so, but I've always loved to recommend families to you guys. I've always done that still. And so I just feel like it's a great organization because people truly need it. And so one of the questions on today, why insurance is so confusing for families?
The simple answer, they making it confusing.
Yeah.
I have clients who are highly educated,
Yeah.
CEOs, attorneys. You would think those are smart people, and they are truly smart people.
Yeah.
But when it comes to the insurance, it's a different language.
Yes.
The first, it reminds me of my meeting back when I was working in a hospital.
Mm-hmm.
My boss said, okay, now you're ready to move on to Medicare because Medicare is the cream of the crop.
Yeah.
So you learn everything else. No, it's time to learn Medicare. The first Medicare I sat in, and I was like, what did they just say? I said, I know English is my second language, but
Mm-hmm.
I understand words, but I'm not putting the two things together
Right.
because Medicare has its own language.
Yes.
And you have to learn that language in
Mm-hmm.
order to understand what's happening.
True. So true.
So insurance has its own language. I mean, sometimes I'm reading a policy. Whenever I acquire a new client,
Mm-hmm.
I want to see their policy. And the policy is around 80 to 150 pages.
Yeah. Easy.
So I just look at the policy and go through it real quickly. And my husband say, you're reading that really fast. But I am looking for certain things.
Right.
And that's one of the things I do when people changing jobs
Mm-hmm.
or when people changing insurance policies within the company.
Mm-hmm.
They come to me and say, can you look through these and tell me which one is good for me?
Mm-hmm.
So it's one thing to look at the policy,
Yeah.
and then another thing to know what the person wants and needs.
Mm,
because everybody's medical needs are different.
exactly.
So I know my clients, I know what they want, and I look at the policies with that mindset.
Hmm.
And then I advise them that this one will work for you.
Yeah. And that's amazing that you do that. I love that because, so many people don't know. I know we get a lot of clients, they'll come in, they'll call and they're trying to get something through insurance. And when you explain it to them, like what their benefit said, or what, it was, we can't provide it, or it was out of network, all these different things, right? It's just so many different moving pieces, and they're like, what, like that doesn't make sense and all that. And so I just feel like when people know, I always say knowledge is power, and when people understand and how you're breaking it down for people, for them to understand and just know that, first of all, they're not alone, and know it's okay to have someone to review and check your policies to see what you have, what kind of coverage you have. Does it cover equipment? Does it cover home health services and all those things? Because people don't know until they truly need it, right? And so for you, what do you think the difference between, well, first of all, I know where we are with Medicare, right? But what do you see the challenges for when it comes to Advantage plans and the traditional Medicare?
Okay, so that's another thing I do. People come to me when they turn 65 or when just about they turn 65
Huh?
and ask about Medicare, help them understand Medicare.
Mm-hmm.
And I try to simplify it and explain it to them.
Mm-hmm.
But I know most of it doesn't stick
Yeah.
because it's extremely complicated. Um, when I look at Medicare enrollment for the first time, I always consider where the person lives.
Yeah.
Um, I had one particular family for years,
Mm-hmm.
and he finally retired and he was working, he was a professor, a law professor,
Mm-hmm.
and he was working in one of the big universities in New York. And they automatically offered him a Medicare Advantage plan.
Oh, wow.
And I said, it was a better Medicare Advantage plan,
Mm-hmm.
but I said, look, this will not work for you as long as you live in New York City. It will not work because you're going to have a problem getting doctors to see you. And he didn't listen.
Oh, that's only the case sometimes.
He didn't listen. That's fine.
Mm-hmm.
3 months later, I got a frantic call. I can't see a doctor. Nobody wants to see me. There's no cardiologist in the city who would take my insurance. And
Yeah.
I said, I am sorry. I will try to help you finding somebody. But this is what I told you it's going to happen. So, end of the year, it was the first thing on the agenda to get him out from the Medicare Advantage plan and get him back to traditional Medicare. Now, the problem with that one is it will work in New York. You can you can terminate your Medicare Advantage plan and go back to traditional Medicare.
Mm-hmm.
Problem is, it's only 4 states that allow you to buy a Medicare supplement plan.
Wow.
New York is one of them. So what happens is if you want to get out of your Medicare Advantage plan and you live in what state you live in?
I'm in California.
Okay. If you live in California, the Medicare supplement can decline your enrollment. They can tell you we're not selling a policy. So now, with a $1,600 inpatient deductible
Oof. Yeah.
at a 20% coinsurance without a supplement, you are looking at substantial medical expenses in case you need it.
Right.
So people enroll a Medicare Advantage plan not realizing that they can get out.
Wow.
So with him, it was okay because New York is one of those states that allow you to buy a policy.
Mm-hmm.
And it is regulated by the state of New York.
Wow.
So it's very, very complicated. Medicare Advantage plans are tied into Medicare, but does not give you the opportunities as Medicare do.
It's true.
So let's say you fell and you hurt your knee. If you have traditional Medicare, you go to an orthopedic doctor, he will prescribe you an MRI. You go to the MRI, you get it done, and then the doctor can look at it and, further pursue whatever treatment you need.
Mm-hmm.
If you have a Medicare Advantage plan, it's harder to find a doctor. Once you find a doctor and he decides you need an MRI, now you need prior authorization. A prior authorization process is a bit complicated because now the doctor has to justify why he ordered it.
Mm-hmm.
So he needs to medically state that you are in a lot of pain, there's a suspicion of a tear, and then it has to go to the insurance, and a nurse, more likely, going to look at it and decide if they approve it or not. Now, this process takes time. Meantime, your knee is hurting you, and you don't know where you're going, you're just sitting there waiting.
No, it
I
is.
mean, this is a very simplified example, but a Medicare Advantage plan is the one who will make you getting prior authorization.
Yeah.
And that takes time. And then if you need surgery, that's another prior authorization.
Mm-hmm.
And I know firsthand how many things can go wrong with prior authorizations because I have a number of clients came to me after they decided to pay for the MRI or pay for the surgery and then fight it out with the insurance.
And still not get reimbursed.
And then, you working on it. I presently have a client, a long time client, but it was a new issue. Um, his insurance denied the authorization for his surgical procedure.
Mm-hmm.
He decided to go and get it anyway because he was in pain. He paid for it.
Yeah.
And then that was based on the authorization. The authorization insurance said, we're denying it because your doctor didn't supply enough information.
Yep.
So now I'm addressing it at the tail end. I filed an appeal. The insurance still denied.
Mm-hmm.
He lives in New York. So I send it to the state insurance department. And I came across someone who really not that educated on insurance because they rejected my appeal, which I turned around and said, no, that is a wrong answer. The rejection was based that the patient didn't have a policy anymore, which is true. But at the time of the denial and at the time of the surgery, he
Mm-hmm.
had this policy active.
Right.
So I responded to the state
Mm-hmm.
and stated that. And 2 days later, I got an approval for the review.
That's how it goes. You have to be persistent. But the sad part about that is, Katalin, is that that I know that, but it's so many people, and we got a lot of people who other people who know, but it's so many families that don't know.
Yeah.
And if there is not an advocate like yourself or myself that's out here and others just trying to advocate to help people, it is just the layers. It is so crazy. So, and when you have the knowledge, you can do that. But Yeah, it's wild. If someone told me the other day, it's the wild, wild west.
It is.
It's
It
the wild,
is.
wild west.
It
And
is.
oh my God, yeah, it is so bad because I feel like, I don't know where the turning point is. I know for us, the same thing. It's like, we get patients need equipment. They need equipment. Like you need this in order for to get around, or you need it to be able to elevate and all these things. And the paperwork is just, and it has to be so detailed. And for us with Medicare, they have up to 7 years to take back money that they paid for a product. So you have families who, if you give them a product and the documentation isn't proper, and CMS comes in and they ask for, I want to see Mrs. So and so's paperwork. And if you don't have that paperwork outlined properly, you can even have a prescription on file, but that's just not enough, as you know.
Yeah.
And they have up to 7 years to come back, ask you if you don't have the proper documentation. And now it's even worse now, because now where we will be surveyed as a provider every 3 years, they're going to every year with us now
Wow.
as a provider. Yeah. So for DME. And so it is a lot. And so I tell people, I tell like my team, my billing team, like, you guys have got to make sure that paperwork is proper. It has got to be in there. It has to be documented properly. And I hate that we got to call the doctor back 5, 6 times. But if we don't get that documentation, we can't provide it. And we want to help people. We want to service them, right? But
Right.
sometimes it is pretty difficult because the paperwork has got to be proper.
Yeah.
It has to be proper. So yeah, I mean, like, yeah, it's so crazy. So the next question is, and you probably already covered this because you've already kind of told us a lot. This is the most important first steps to understand about your policy, which you can think you kind of touched on that. As far as like reading your policy, or how would you say when someone gets a policy, or before they entertain on getting a policy, especially around the first of the year on enrollment time, what would you suggest they do before they make those decisions?
Well, they should know what they need.
Mm-hmm.
I mean, most people have an assumption that I have a good insurance.
Yeah,
And then they start to use it and they realize they don't.
right. Yeah.
So, I mean, if a person is working for a company, you get what you get. You have a couple of choices,
Mm-hmm.
and then you can decide which one of those choices are most suitable.
Mm-hmm.
Um, I mean, you want to look at the basics. You want to look at deductible. You want to look at out-of-pocket cost.
Mm-hmm.
And often policies have in-network and out-of-network deductible.
Mm-hmm.
And then you need to understand if your policy is in-network only, the HMOs, the EPOs,
Mm-hmm.
and those are just in-network only. So they cannot go outside of that network to request services unless they come across somebody like me
Mm-hmm. There's
to
somebody to
figure
help
a
you.
way to do that.
Exactly, right?
But there
Exactly.
is there is a way. I had clients who had an HMO policy only in network
Mm-hmm.
who find an out of network provider, and there are certain loopholes.
Mm-hmm.
It's called the network adequacy rule.
Mm-hmm.
So if there is a doctor who is in a 50-mile, just the only specialist who can provide that specific care,
Mm-hmm.
then you can request a network exclusion, and then the insurance will prior approve the services.
Right. Mm-hmm.
And then you need to know if you are satisfied using in-network doctors only, or you're willing to go to the extra cost to go out of network. The common tipping point, what I see when it comes to this, is when the insurance policy said we pay 90%. People think it's a 90% whatever the doctor charges.
Mm-hmm.
That is not true. When the policies say we pay 90%, it's also say it will pay the maximum allowed amount at 90%. which is a completely different number than what the doctor charges or the hospital or whoever.
Mhm.
It used to be usual and customary. Now they call it maximum allowed amount.
Mhm.
Um, a perfect example, I see a lot of clients who have a policy which reads, we pay 110% of Medicare rate at 70%.
Mhm.
And yeah, you have to start to doing the math, but Medicare rates are nationally publicized. So
Oh,
you can just go on the internet and say, okay, I live in California.
mhm.
Let me see the California Medicare rates in my zip code.
Right.
And you can actually download a very long, large spreadsheet, but it has all the numbers.
It does. It does. It is
And
clear.
yeah,
Yeah.
and then you look at the CPT code, which is mostly a 5-digit number. When it comes to medical equipment, it's a letter followed by 4 numbers. And you can actually look up the rates.
Yeah.
And then you can start to do your math.
It's so interesting because we find ourselves when we explain that to families. So like you talk about the example, they say, "Oh, I talked to Medicare and they say they're going to pay 100% that I can get what I need," and I'm like, "Yeah, within reason." So one of the things we talk about the rollator, which is I'll just throw that out as an example. Rollator they pay, I think it's $74 now. It might have changed. It might be 64 now, but I'll just say $74 as an example of what they pay. That's the allowed amount, right? So oftentimes they'll think, oh, they're going to pay $74 of that. Well, we know, as you know, to get a rollator for $74, one that's a good quality, that's going to last and do what it needs to do, $74 is not a lot. Those, I mean, they're going from what, $100 and up. And so if the allowed amount is $74, that's 80% of the $74 that they're going
Right.
to pay. And that the 20%, then if you don't have a secondary, have to pay that. But if not, you have to pay out of pocket for that. And it's so crazy because that's why a lot of providers like myself, a lot of them have either went out of business, or they're not no longer taking insurances, or they're picking and choosing which items that they can do because of the allowed amounts. It's just not there, and competitive bidding is lurking now. So it's just really interesting how this is going to play out when people need equipment. I think it's just kind of almost forcing people to have to pay out of pocket, if that makes sense,
Yeah,
because of the
it
rates
does.
are so tight. Yeah, and so, and I wish, and it was so sad because people don't know that way. Oh, well, they said they were paying. I'm like, yeah, it doesn't unfortunately work that way. And you can't get it overnight like you do prescriptions. If you go to a pharmacy, you have to, there's a process. It could take a week, 2, 3 weeks. I've even heard people took a month and 2 months to get just a bed or whatever because of documentation and all those things. And people are, there's a lot of audits going on. There's a lot of, surveys going on. It's a lot going on in the industry. And so we just have to, but try to advocate and give resources and information the best way we can so people can be better prepared with knowledge. That's what I think. So yeah, so where do you think we're going, where the insurance is headed in our current state as far as with some of the cuts and things of that nature for the allowed amounts? Yeah,
Nothing good.
nothing good, I know.
Nothing good. I mean, over the years, we, back in the old days, 30 years ago, we had traditional indemnity insurance.
Hmm.
And it's pretty much paid 80%, you pay 20%, and it was pretty much within the range of what the doctor charges.
Yeah.
Then they came up with the brilliant idea of the HMOs. And in the beginning, the HMOs were good because you had a $5 copay for an office visit
Yeah.
and you were good to go. But now all these policies are changing. You have the high deductible. I mean, for a family of four, $3,500 deductible per person or $7,000 per family. That's insane. And that's just a deductible. And even people who have a better policy, they still have cost shares. I see more and more policies where you are in network and you still have to pay 10% of your share.
Yeah.
So, good, really, truly good policies are very hard to find nowadays.
Yeah. It's tough. It's really tough. Yeah, so but I think that what we can do the best we can is just keep advocating, right? And just trying to do the work that we do by giving people information as we just mentioned, I mentioned earlier, and just sharing all this great information like you and yourself. And so I think our last question was the biggest misconception people have about insurance coverage. I think you kind of touched on that a little bit, where people think things are covered when they really aren't. Would you say that?
People think, I heard it so many times, I have good insurance. And then they start to use it. And now all of a sudden, all the ugliness comes out. The other thing I constantly hearing, I pay so much for this policy and they don't want to pay because the premiums stay insane now.
Hmm.
I mean, with the Affordable Care Act,
Mm-hmm.
and they've put in the Affordable Care Act, and it was a good idea because it has a number of good protections. The
Mm-hmm.
most importantly, the no pre-existing.
Yeah.
It's a big deal because a lot of people have problems, and the pre-existing is, oh, we're not paying for your heart problems because you had high blood pressure before you got this policy. So those things went away, but the cost is escalating. And you know where that money goes?
Wow.
Wall Street,
Mm.
United Healthcare. Look at the stock prices. It's keep going up. They're losing members, yet they more profitable. Where is that coming from? They don't pay on claims.
Yeah. Yeah. It's
It's really, really sad. But yeah, the only thing we can really do is fully understand the policy.
yeah. Yeah.
I mean, the first thing I do, I have this client and she sent me a bill and I filed it. The doctor was out of network. And she comes back to me and she said, okay, so the doctor want to do this procedure and it's going to cost me $6,000. Can you look it up how much my insurance is going to pay? I looked it up, $260.
whoa.
So I said to her, I think you might need to consider finding a doctor in network whom you are happy with who can do this procedure. And it's not a complicated or, unusual procedure.
Mhm.
So she's smart. She looked into it. I got an email 2 days later. She said, don't worry about it. I find a doctor who can do it in network.
Yes, but thank God. But see that, and that is, you have, what you've done is you saved her time, and you saved her money.
Yeah.
Because and those things matter. We tell people that I push clinical assessments all the time, product clinical assessments rather, for us in our industry, because people go out and they spend money on stuff that they don't know what questions to ask. They don't know exactly if they're getting the right item or not. And I'm always trying to push, like, no, get a clinical assessment, a product clinical assessment. Because sometimes when I say clinical assessment, people think I'm talking about going to the doctor. No, I mean clinical assessment where we assess your, diagnoses, what's going on with you, and then matching it with the product, right? So
Mm-hmm,
you're
mm-hmm.
kind of analyzing everything because every product doesn't fit all. One size does not fit all. You may have the same diagnoses, but your movement things may be a little bit different. So you may need something totally different from the next person. So so those things are so critical and so important. And so getting an assessment done, I will say that's like an assessment from
Yeah.
you to make sure, like, let me see what my policy has. Can I do this before I approve this surgery or go through this process? And I think so it's so bad with this, out of network. People don't even know, they a lot of, as I mentioned earlier, I get so many patients that don't know if they have what insurance they. I'm like, what insurance do you have? Oh, I have Medi. I'm like, okay, so is that a traditional Medicare or an Advantage plan? I don't know. So it's so important that people educate themselves. That's the only way you're going to make it through, to make sure that you're not going to be hit with a bill down the line.
Yeah.
Yeah.
Understanding your policy is key. You need to know what you have.
Oh, yeah. Yeah. You need to know what you have and what you don't have. Literally. You do. You do. So, one of the questions is, when should someone involve a claim assistance professional like yourself?
It's, it's always a good idea to have somebody on your side at any given time,
Yeah.
in my opinion,
Yeah.
because sometimes all you need to know is what is your policy?
Yeah.
How can I use it? What is best utilize my policy?
Mm-hmm.
Other people I have seen taken over. I had a young man who was transported by a helicopter from one hospital to another,
Mm-hmm.
and the mom filed an appeal
Mm-hmm.
and it got denied. And when I looked at the appeal, what she wrote, it was an emotional pleading to the insurance. And that's not
Yeah.
the direction you need to go. When you file an appeal, it needs to be up to the point why it was medically necessary.
Yep.
It's it's anything basically, because understanding your policy, enrolling on Medicare,
Mm-hmm.
trying to find resources for your particular medical illness.
Right.
We are not nurses, but we can look at your insurance network and trying to help you find the right doctor.
Right.
I
Exactly.
mean, I have a client in Virginia, and she was all tangled up because she said, where I live, there is no Medicare doctors. So I simply went online, I downloaded all the Medicare doctors in her zip code. And I sent it to her. I said, here are the doctors,
Yeah.
primary care doctors, who's willing to take you with your Medicare.
Oh my gosh. Well, good. That was a good thing. Oh, Katalin, that was, and that's the thing. And that's what you bring. That's what you bring. And that's why people need to know before they need to know. Right. And so it's good to have an advocate out there that can support you and tell you what you need to know and how to navigate this insurance system, because it is a lot. So, what would you say, how, if people wanted to get an appeal done, or they get a bill, they don't know what to do with it, or they just want someone to review their policy? Can you tell and share with the audience how they can reach you?
You can they can go on to the Alliance of Claim Assistant website.
Mm-hmm.
That is claims.org.
Mm-hmm.
There is a tab for finding an advocate.
Mm-hmm.
Find a cab.
Mm-hmm.
It's a little drop down menu, and they can look, and we have presence nationwide, not every state,
Mm-hmm.
but most of us are perfectly able to work anywhere in the country. I
Right.
mean, I had clients in Hong Kong, Singapore, Germany.
Yes.
So we do claims nationwide. Presently, I have a client in Washington, California.
Mhm.
So it's really doesn't matter. Insurance laws are slightly different from state to state, but we have a know-how to look it up, or, you know, it's sometimes when people come to me and ask for a specific problem,
Mhm.
I look at it if it's a generic, it's a broad spectrum problem anybody can address within the group, or it should be going to a certain state.
Right.
So I decide, if people send me an email, I decide if I should refer it to somebody like in California or Colorado or New Jersey, or I should look for specialized request.
Right, right, for that particular state or that
Right,
particular situation, right?
right,
So
right.
that is amazing. And you guys are about the only, I think, if I'm not mistaken, I think ACAPS is about the only company out there that really does this type of work. I've had people call me before me like, "Oh, I'm trying to find someone." And I give them you guys' information because they said we've searched everywhere, and I'm like, "Well, yeah, try ACAPS because they are there and they are good." So yeah, and yeah, it's a great team and a great membership, and so I want to thank you again, Katalin, for being on here. We're gonna have to get on here again, I'm sure, in a couple of months to try to go over some new things and new regulations that's going on right now. And your information will, you guys, the audience out there, you will be able to get a hold to Katalin because what we do is we create what's called a blog, and we put her contact information inside of there, so you'll be able to access her on our CFS app. You can download it on Apple or Google. And again, this is the medical equipment world and healthcare. Get the scoop. And we are thanking you for listening to us again today. And we will see you on the next episode. This podcast is sponsored by CFS Medical Supplies and Equipment and CFS Solutions, where you get all your great healthcare information and real boots on the ground experience. That's what I say, Katalin. I say boots
I
on the
like that.
ground, right? Because we are not just talking about the situation. We are in it every day. Caitlin is in it every day. She has clients she's working with constantly, real time, real time. This is not a theory we're talking about. This is not us just, getting on here saying like, oh, this happened, that happened. No, we are boots on the ground. We're in it. We're dealing with families every single day, trying to help them solve problems. And so that's what Katalin does, and that's what we do too. We are boots on the ground here at CFS Medical Supplies and Equipment, CFS Solutions. So again, if you guys want to get some information, and the app, let me say, it's free. It's a free resource app with videos and resources on there from all type of things dealing with healthcare, and then also you're able to listen to the podcast from there and get this great information that we try to share to help families navigate this world of healthcare. So again, thank you for listening on. And Caitlin, thank you again for being on here with all your knowledge. And so we will see you guys on the next episode. Thank you so much.
You are most welcome.